We have a 54-year-old man who presents with acute onset of seizures and hallucinations. The patient's wife says that he had been camping on a camping trip a few months earlier to study bats, but otherwise has not traveled recently. Past medical history is significant for hypertension, medically managed with hydralazine and enalapril. The patient's condition rapidly deteriorates and he passes away. An autopsy is performed and a histologic stain section of the brain is shown in the image. Which of the following receptors are targeted by the pathogen that is most likely responsible for this condition? All right. So we have option A, CCR5, option B is CD21, option C is acetylcholine receptor, option D is ICAM1, and option E is GABA. So yeah, this is rabies. The arrows are pointing out to Negri bodies. How did we come to the diagnosis? So firstly, they are what? Let's see what they're asking. They're asking us which of the following receptors are targeted by this pathogen. All right. So yes. So when we read the question, we have a 54-year-old man with acute onset of seizures, hallucinations. All right. We still need further information. Now, when we go through it, we see that he went out a few months earlier to study bats. So bats is the number one cause of rabies in the United States. So you have to remember that. All right. And other things are not very significant. His condition has rapidly deteriorated. All right. And then when you see this image, if you're familiar with it, you will know that these are the Negri bodies which they have marked. And then they're asking us which of the following receptor is targeted by the rabies virus. So the rabies virus targets your acetylcholine receptor. All right. And what happens is when the rabies virus makes contact with your acetylcholine receptor, it travels to the CNS in a retrograde fashion via the dyne arms, okay, via the dyne arms, right, okay, and that's how it goes to the cell body, all right, and that's where it causes infection. Always remember, rabies travels in a retrograde direction using the dyne arms, okay.
Thanks for watching. Please give a thumbs up and subscribe for more.